Yes, you have to read back to the framework of the assessment, and therefore you need to then screen. And as we have always said, to have a method by which you approach each patient with the same methodology of analysis is really important, not only for systematic treatment of the patient, but for collecting the kind of clinical data that makes it easier over time to treat patients with a certainty that you are covering as much of the base causes as you go along, so that the cause then of snapping hip, yes, you cannot treat the failure to perform directly. That is a big mistake. You must find out, as we say, the subsystems that have failed or are compromised and are causing the failure to perform. So in that case, you have to start ruling in or ruling out the systems that are involved: nervous system, fascia, etc., etc. And that is what leads you to try to find these relationships and to leverage off these relationships to explain the symptom. As Freud said,
this
sometimes a cigar is a cigar, but you must make sure
luckily
you just have a cigar. Yes.
Well, and you saying that, I was going to say that using this kind of approach, using this kind of method, it keeps re-illustrating to you, in one sense, that things are much more complicated and complex than you might think it is. Not that it might not be that difficult to actually treat necessarily, but it's just you constantly see the global effect of this one problem in their low back, and you start to realize, dear God, they have this problem in their low back, and it's on the right side. It seems to be a right side of low back issue, but it's affecting everything. It's affecting their shoulder. It's affecting their and you then, at that point you think, my God, what can I do? Should I treat a shoulder? Should I treat this? Obviously you stick with the system, and it seems to make reasonable sense, but it constantly is reinforcing to me how complex and complicated the body actually is. And it's not just a matter of doing 10 back extensions and you're cured of all of your sciatica for the rest of your life, because there's constantly this global response that you have to kind of account for a bit.
Yes. And the deficits you can find out that the deficits reappear in different forms, so that you can have somebody who has back pain one day, and you treat the back pain. They go about their lives. They stress their back in another way because they're feeling good. They do something. The next time they have hip pain, it's still the same back pain, but it's now returned in a new disguise. It got strained, and now the symptoms go to the hip, and the back seems fairly okay. And then you treat the hip, you treat the back, everybody's happy. A year later, that same disc problem that you saw on the MRI comes back as a painful foot. The patient goes, you know what? I wore a pair of shoes. I've worn these shoes before, but this time they really hurt. And I don't know why. You think it's the shoes, and you go, let's see. So you go about, and then you find out, no, your foot is now sensitive to stresses it used to be able to manage without any complaint because of your back. The changes that are slowly taking place in your back, or your inability to repair, or the fact that you are exceeding the potential load your back can tolerate now that it has been injured, is causing different symptoms to recur. And therefore, it's really important then that my treatment for the back covers not only the treatment to the back, but stabilization that is adequate to even more demanding activities over and above what you were doing when you came to see me, because I'm not in control of your decision to go hang gliding or to to go to
Yeah,
Acapulco,
you
jump off the
decide you're going to
cliff.
train for the marathon for the first
That's
time.
right. You suddenly decided that now your back's better, you're going to train for the marathon. Well, that annular tear, asymptomatic now, but still having a potential destabilizing role, may come back to haunt you, and it will not hurt your back. It may start to give you a hip problem, which will not go away. So it's really important that we are so thorough so that we can trace back a recidivient symptom or a new symptom under the guise or recidivians under
I
the
was going to
guise
ask
of
you
a
to repeat
new
that
symptom.
word. Let me look
Recidivians
that
under
up.
the
Hold on one second.
under the guise of a new symptom that is related to an original injury that is not is has been re-challenged. This
See,
is
this
a
is sorry.
constant.
I don't want to go
Mm-hmm,
off topic too much, but
mm-hmm,
this I feel. I mean, I see general population patients.
mm-hmm.
I'm not seeing elite athletes or anything like, or not just pediatrics. General everyday people, and I've found, unfortunately, that it makes things when you use this kind of approach, they have a whole bunch of underlying orthopedic problems and things like that just get flared all the time. Whether it's, when they act, when you actually check their shoulder range of motion, it's not just, oh, I have a tiny little bit of tightness. No, they have a significant loss of range of motion in their right shoulder that never really, nothing ever happens. But then they go skiing or they do that, and that kills them at that point. Their neck isn't so bad, but then they drive for 6 hours, and if they ever have gotten an X-ray, that X-ray looks horrible, and they can tolerate this because they're not too active. But then they do something, and then that blows up. And trying to manage musculoskeletal conditions with patients who have actual significant arthritic change, degenerative change, range of motion losses, it's very difficult. It's very
It
difficult
can be
because,
challenging, yes.
yeah,
It
because
can be
there's
challenging.
usually, not always, but usually the kind of person that has significant range of motion losses like this, or significant degenerative changes, are usually not the kind of people that are going to take a more active role in stretching and self mobilization. So it's like the very things that are required to actually make them feel better are the very things they're never going to
They're
do.
not trying.
So
That's
it's
right.
almost like I just constantly point out all the faults that they have to them, and they go, "Oh,
Mm-hmm.
that's nice." They
Yeah,
crack your
that's right.
back,
And you,
rub here, rub there, and I
that's
try
right.
to show them the stretch and the exercise, but either it's too painful for them to do it, or they're just not. They're not the kind of person that does it. It can be
And
very challenging.
I think that is why the analysis of what else will help them stay strong using small doses of daily exercise, um, repetitive pulsed exercises is really important
Yeah.
because I keep on telling my patients, I go, I'm going to give you exercises you can do in the shower before you leave for work because you need to prime your body for the beginning of the day and what you're going to do, not trash it between now and 2 p.m. and then go to the gym and load it again in the hope that it will
This is a
recover in
whole new
time for
DNS
the
skills
next.
course. This DNS shower. It's only for adults, this course.
Yes, that's right. It's skin to skin. But yeah, you must have simple exercises, but they are based on the deficits that you observe. You are going to give the patient references, sensory motor references that will help them determine that they're doing it well because you're not there to correct them. And this
If
brings
you
us.
enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.